Welcome to the North Carolina Medical Society Spotlight. I'm your host, Sue Ann Forrest. Today we have a very special guest with us here in the North Carolina Medical Society headquarters, Dr. Alyson Shogan. Dr. Shogan is an internist at Duke, and we're excited to learn a little bit more about her involvement with Choosing Wisely. Dr. Shogan, thank you so much for being here with us today.
Thank you for having me. I'm excited to be here.
And you're very involved in a Choosing Wisely grant. Can you tell us a little bit about that?
A few years ago now, some of the leadership at Duke became aware of the Choosing Wisely grant. And in particular, Dr. Dev Sanghvi, who's one of the Associate Chief Medical Officers at Duke and the Medical Director of Duke Well, Duke's Accountable Care Organization, really has spearheaded the project. And he became interested in the grant and found many other organizations in North Carolina were also interested.
What were some of your main goals and objectives?
Yeah, so the grant was a 3-year grant, so we really had time to ramp up and come up with a clear approach and plan. The grant is through the Robert Wood Johnson Foundation, and as you guys know, Choosing Wisely is an initiative of the American Board of Internal Medicine. And so Choosing Wisely in and of itself has hundreds of recommendations to try to eliminate unnecessary waste and promote high-value care in the healthcare system, and also promote the conversation between providers and patients about what tests are really going to add value to their care. We came up with a few different initiatives that we focused on. The one where we really put the majority of our efforts is decreasing the potentially unnecessary use of antibiotics in upper respiratory infections or viral bronchitis.
Dr. Shogan, tell me a little bit about the stakeholders that were involved in the Choosing Wisely grant.
Yeah, so Duke was really lucky that we had a great group within North Carolina that we partnered with. The North Carolina Healthcare Quality Alliance and the North Carolina Medical Society really helped put the group together for the grant and helped spearhead things. And Cornerstone Health, Blue Cross Blue Shield, the state health plan, and many other organizations were also involved, which was great because we had quality groups, medical society, insurers, delivery and hospitals all involved and had this multi-pronged approach, which I think is so important because healthcare is increasingly becoming a team sport and we're no longer practicing in these silos anymore.
Right, and with that, how did you get physicians to really buy into what you're working on and achieving these goals? How were you able to do that?
Yeah, so there was definitely a little bit of resistance at first. I think one of the things that was so important was that we started by trying to get physician champions really at a high leadership level as well as at the individual practice level, so kind of a top-down and ground-up approach. I think once physicians could really see that we weren't trying to tell them how to practice medicine, we really just wanted to give them the latest evidence-based medicine information and resources on how to talk to their patients and tips on how to have these sometimes difficult conversations. They were actually very supportive of the project and saw it as an asset to their care.
That's great. Yeah. Now, how did patients feel about the grant and the initiatives that you were going with? I'm sure that there were a lot of tough physician-patient conversations in the mix.
Yes, there are definitely those times where patients come in, especially in the winter months with a cold, and they think antibiotics are the be-all, cure-all and will make them feel better. And so a lot of it is just giving physicians tools to have those conversations, but then we also tried to reach patients in a variety of settings. And that's one of the reasons having all these different groups involved was so important. So the Medical Society, the NCHQA, the state health plan, did a lot of messaging out to patients to reach them outside of the clinical setting. And then we tried to train our front office staff, had brochures in the waiting room, had posters on the wall in the exam rooms, and messaging on the pin stations or screensavers. And so tried to message to patients as soon as they got in to the office, and so all of the burden didn't lie on the provider.
You had a lot of success in this grant. You had a 20% goal. Could you tell us if you met that goal and kind of your next steps after that?
Yeah, so it was great. Duke's really proud that we were able to not only achieve but exceed the 20% goal. And what that meant was we ended up with a reduction of relative reduction of over 30% in the use of unnecessary antibiotics in viral illnesses. Thank you. And so, one thing we wanted to make sure of was that we weren't just tracking a number or a metric, that we were actually having a positive impact on patient care and clinical care. And so we looked not only at the one diagnosis or ICD-10 code that was being followed by the grant, but pulled a variety of other diagnoses that would be involved in upper respiratory infections, and saw a decrease in the prescription rate of avoidable or unnecessary antibiotics across all of those diagnoses. So that was great.
So how do you move forward? Do you think that you've really impacted and kind of changed the culture at Duke on patients and physicians asking for unnecessary antibiotics?
Yeah, I think that's a great question and a great way to phrase it, actually, because we achieved this metric. But I think you're right. One of the most important things, and one of the things that we're hoping to take away from the grant, is this focus on quality care and continuing to be a learning health system. And some of the ways you can get there are by focusing on these metrics, but what it really comes down to is a continual culture change, because that's what makes a difference in a health system. Big things that we're doing with the grant is that choosing wisely is being incorporated into our graduate medical education training. So for the residents and fellows, it's becoming part of their curriculum, which is great because this is the next generation of physicians, and it will be an important part of their clinical practice.
Shogun, thank you so much for joining us for our Spotlight video series. We look forward to hearing about your continued success and the success of this program.
Thank you.